Welcome back to Takacs McGinnis Elder Care Law Hour, where we explore the many issues that due to aging, unexpected disability, and long life. I'm your co-host, Tim Takacs. Today we're discussing resources for the under-resourced senior.
I'm Barbara McGinnis. And what if you're at home and you need help paying for care, or if it's time to move into a long-term care facility, but you don't have the resources to pay for that? What are your options? With us today is attorney Chris Coleman from the Tennessee Justice Center, and you're going to tell us more about what's available for these folks. Welcome.
Thank you.
I think this is your second time to be on the show, but we always learn stuff
welcome
from
back.
you.
Thank you.
You may want to just remind people, what is the Tennessee Justice Center? What do you do?
We are a nonprofit law firm that was founded in 1996 to help when the basic necessities of life are at stake for people. So something like, how can a low-income senior find help, care around their house, or if they need meals or things like that. So we help on both Medicaid and long-term care and Medicaid, and on the food stamp program as well.
Oh.
Right. And I know you were here when Caitlin was talking about CT&M and 50 Forward. Gretchen was here. Those sounds like programs for people who are able to live at home somewhat safely or independently. But what about the senior that can't live at home safely and independently and has no money or very little money? What are their options? What government options are available?
There are, through the Medicaid program, which in Tennessee we call TennCare.
Yeah.
There are some services available just for people who can get on TennCare, but if they need a little more help than that, there is something called the Choices program.
Okay.
And Choices provides help, in-home help or nursing facility payment for people who can't otherwise afford it.
Mm-hmm.
So Medicaid, TennCare, and Choices are really the same thing when we're talking about care at home for seniors.
Right. Choices is the TennCare Medicaid program that provides care, long-term care for people.
Yeah, I know the way we put it is TennCare Choices in Long-Term Services and Supports, which is the, I guess that's the official name. That's
right.
A real mouthful.
Yeah.
Right.
So we just call it Choices.
Choices at home, choices in a nursing facility, well, I guess is really what it would be for us. So.
But who qualifies for Choices?
Well, there are three groups in Choices. Choices Group 1, Choices Group 2, Choices Group 3. They made that easy. Choices Group 1 and Choices Group 2 are for people who have their physical problems are enough to qualify them for a nursing home. Choices Group 1 is if they need to be in a nursing home. Choices Group 2 is for people who would physically qualify for a nursing home but can safely be kept at home for less money than it would cost to put them in a nursing home. So they can get the array of services and supports that they would get in a nursing home, except they can stay in their own home. Choices Group 3 is a slightly more limited program. It's for people who are at risk of going into a nursing home. But this program, you have to be receiving supplemental security income, so SSI.
SSI, yeah.
And that program, the cost of the services is capped at $15,000. So
$15,000 a year.
A year. Right, which when you're talking about
Whoopee, right?
Yeah, home-based services, that's not a whole lot, but for people who do need just a little extra help around the house, and that might keep them out of a nursing home longer, that's the program.
Do you still need, for the Choices 3 program, do you still need to basically meet the criteria of needing nursing home care?
No, so all of these, the physical criteria are all based on what are called activities of daily living. And these include things like eating, toileting, transfer, getting up out of bed or from a couch to a chair, self-administration of medication, things like that. So,
but not dressing and bathing is what I understand.
Not dressing and bathing, yes.
Yeah, because all of our viewers are going, well, what about?
Yeah, not dressing and bathing. So if you can't bathe yourself, you don't qualify.
Right.
But and there's a complicated scoring system for how you qualify. For Choices Group 3, the smaller, more limited program, you just have to show that you need substantial assistance with one activity of daily living.
Gotcha.
So let's say you can't self-administer your medication. You have some kind of eye drops or something that you can't do on your own. You could qualify for Choices Group 3 if you are on SSI, and then have somebody who can come by once a day to check and make sure you've taken your meds and are able to administer them, things like that.
And that's the $15,000 a year program.
Right.
So maybe that's a good option for some. So there's some cohort out there that really can benefit from that.
Yes, I think
You know,
so.
I don't mean to be.
Right.
When we say it's not very much money, certainly it's not. But at the same time, it's a life. It can be a lifeline for a lot of people.
Right, and it used to be open. It used to be a very important way for people who. Everyone on SSI automatically gets TennCare. Gets your basic health insurance, TennCare. TennCare then closed that. Now it's everybody on SSI who can get in Choices Group 3. Before, you didn't have to be on SSI, so people who didn't have access to TennCare at all, who didn't have health insurance, if they qualified for Choices Group 3, they could get both the $15,000 of services plus full TennCare benefits.
So is there a financial eligibility criteria for Choices?
There is. So when you're looking at financial criteria, you look at two different things. You look at income and resources. So income is what you get paid every month. Resources are what you might have in the bank. For income, for Choices, it is $2,250 a month. So anyone with income below that qualifies for the program. And the resources are, for an individual, it's $2,000, excluding their home and one car.
Okay.
For people who are slightly over that income limit, there's something called a qualified income trust that people can create. It's fairly simple to do, and they can put anything over income in this trust and use it for certain medical expenses.
We get from time to time people call it a Miller's Trust.
A Miller's Trust or a special needs trust. I mean, there's lots of
there's lots of these.
Lots of little words for it.
Right.
But what kind of home services are provided under the Choices program, Group 2?
There's a pretty broad array of services. So there are, for personal care visits, which are less than 4-hour visits by somebody to come help around the house. And there are, for people who need more than that, there's what's called attendant care. So if you need somebody around for 8 hours a day or something like that, you can get attendant care services. Those are people just to help around the house, make sure they stay safe, help with activities of daily living. But there's also things like home delivered meals, personal emergency response system. So for people who might worry that they're going to fall, they can have a button that they wear. There's adult daycare that's also funded. I think we heard a few minutes ago some about adult daycare. There's respite care, both in-home respite and inpatient respite, where if there's a home caregiver, some other member of the family who lives with them, and they just need a break because they've been working for a long time, and you can get somebody to take care of mom while you get a break.
Right.
You can get assistive technology, minor home modifications, and pest control.
I mean, that's quite a bit, actually, when you think about it.
Right, yeah. I mean, it's,
and there's a certain number of hours, I guess, of attendant care. My understanding is 30 to 35 hours a week. Is that kind of
right? I think that's generally the case.
Kind of like a maximum level.
Right.
We always say up to 30 to 35 hours.
Right.
And of course the MCOs that manage the Choices program, they have the ability to exceed that if it's still cost effective for them to do that.
Right. You know, we want people who can to be able to stay in their homes as long as they can. So sometimes MCOs will do things what are called a least costly adequate alternative or things like that to allow.
So how do I sign up for this?
There's two different ways, and it depends on if you are already on TennCare or not. If you're not on TennCare, then the first thing you do is call the AAAD, Area Agency on Aging and Disability.
And that would be the Greater National Regional Council here in the metro area.
That's right. You would call them, and they would send someone out to conduct the pre-admission evaluation, the physical assessment to see if you qualify for the program. And then there's also a financial application.
And we actually have someone coming in from AAD here, I think, right after you.
If you're already on TennCare, you can just call your TennCare MCO, which might be Blue Care, United Healthcare, or Amerigroup, and they can set up the pre-admission evaluation.
Okay. Well, we've got just a moment or two left, and you're coming back for our next segment, I believe.
Yes.
So
you're going to be.
I am.
You are coming
I
back.
am.
Yes. So when we get to our next segment, we're going to be talking. We're going to continue our conversation with Chris Coleman of the Tennessee Justice Center. We'll be talking about prescription medications and how those are paid for, and some other programs. So stay with us.